Today we're going to talk about engaging and collaborating with states in EPA research. And I am really pleased to be able to present this webinar today with some of our partners in the state associations. We have Abe Kulungara from the Association of State and Territorial Health Officials. He heads up the environmental health team at ASTHO, and his colleague Nicholas Porter. And we have Sarah Grace Longsworth from the Environmental Council of the States. In EPA ORD, we've been partnering with ECOS and ASTHO for several years now. And it's a very important partnership for us because it's the states who are on the front lines with environmental protection, and it helps us to provide scientific and technical resources to the states and their communities. EPA has resources, technical support, training, science-based tools, and methods that we can share with the states. And in turn, we learn a lot from the states about their science priorities and needs, which helps to inform EPA's research, both our long-term research and our technical support activities. So without much more, I'm just going to go over a few logistics. If you have a science question during the presentation, please type it into the chat pod. And once the presentation is finished, we will go through as many of those questions as time allows. We will post the slides from today's webinar to our EPA Research website shortly, and we will follow that with a recording in the next week or so. So I think that with that, we can jump right into the presentation.
Lisa, can I make a couple of comments? This is Dave Paylor.
Oh yeah, Dave, I didn't see your name on the chat. I'm great. I'm glad you're here. So Dave will give a few brief opening remarks. David Paylor is the director of the Virginia Department of Environmental Quality and the ARIS Environmental Research Institute of the state's president. Happy to have you, Dave.
Yeah, thanks. That's probably because I am low tech and I used a telephone instead of a computer to log in.
No problem.
Anyway, I just want to welcome everybody to the webinar. I think it's going to be really helpful. ARIS, as Lisa said, I'm the president of ARIS, which is the education and research arm of ECOS. And we've really been working closely with ORD now for, I don't know, 5, 6, 7 years, at developing a better and better relationship. Turns out there are really two big challenges. One of them is all of the work that ORD does, making the states aware of the things that that ORD does. And the other one is helping ORD to understand what kinds of research is going to be most useful to the states. And I have to say, the first time that Lisa printed out a list for me of all of the things, all of the research that that ORD EPA is doing across the agency, it was sort of an OMG moment because the breadth and the depth of it is really pretty amazing. And in my view, this is really one of the critical services, if you want to call it that, that EPA provides to the states, because there is no way that the states could afford to do the depth and the quality of research that EPA does, and we certainly couldn't afford to do it 50 times over. So it's just been a great relationship. ORD's been really working hard with us to hear from us, and we continue to work with them to try to find ways to get the message out more and more. And that's also a role that ORD's been having with ASTHO and ECOS as well to get those health issues focused in the way that states could use them too. So I just wanted to give you a little bit of a background from, I'll call it the state perspective of this, and just to welcome you to the webinar.
Thank you so much, Dave. Okay, now we'll jump into the presentation. So today we have organized this to talk about some of our goals for state engagement in EPA's Office of Research and Development and our key state partners, featuring ECOS and ASTHO, engaging states in EPA's research, sharing EPA science and resources with the states, including some new web resources on how EPA research supports the states. And then my ECOS and ASTHO colleagues are going to talk about some of our collaborative projects with state environmental health experts, including our Wildfire Smoke Guide for public health officials and our per- and polyfluoroalkyl substance, the PFAS Risk Communication Resources. So some of our goals for state engagement in ORD, as Dave mentioned, we've really been working hard to connect state research needs with agency priorities to ensure that EPA's research is useful and practical to help the states address those on-the-ground environmental and public health challenges. Also, we've been working, especially over the last couple of years, to engage states early on in research planning through implementation. And we'll talk a bit more about that. We want to ensure that EPA research outputs and products meet state needs. And then third, to use the information that we have, EPA science and technical capabilities and facilities and resources to help strengthen the state's capacities in science and technology. And then finally, to work with state environmental health agencies on joint efforts focused on integrating public and environmental health. And this is really the hallmark of some of the work that we have been doing with ECOS and ASTHO under our Memorandum of Agreement. This is a busy slide, but it just shows that we have many state partners, and really on the environmental side, we work closely with ECOS and ARIS, the Association of State Environmental Agency Leaders, and their research arm, the ARIS Environmental Research Institute of the State. And then a subgroup of ARIS, the Interstate Technology and Regulatory Council. And then on the state health side, we work closely with the Association of State and Territorial Health Officials, ASTHO, and the environmental health team there, and their peer group of state environmental health directors. We also work with ECOS to engage the state media associations for air, water, and waste. So with the ARIS board, as Dave said, works to better connect the state environmental agencies to research. They provide input to EPA on state environmental agency research needs, and they oversee the Interstate Technology and Regulatory Council. ITRC is a state-led coalition, and they work to advance the use of innovative environmental technologies and approaches. Then for ASTHO, ASTHO represents the public health agencies in the U.S., the states and territories in D.C. Some of the environmental health programmatic areas are listed here, and you can see obvious overlaps with EPA's mission, particularly around the built environment, the natural environment, water safety, and tribal environmental health. As I mentioned, they have a peer group of state environmental health directors who EPA ORD has engaged with, and that's been very helpful to us. That group helps strengthen ties among the states, and they share best practices. ASTHO also has a preparedness program, and they're preparedness directors, and we have been starting to work more closely with them on our Homeland Security and emergency response programs. So next I'm going to talk a little bit about how we engage states in EPA research. So the ARIS board conducts surveys every other year to identify state environmental agency research needs. And they share the results of that survey to help EPA ORD strategically align our research with state science priorities. The last survey was conducted in 2018, and this ARIS asked the state environmental agency leaders to rank the top 5 areas in which scientific research would help their state address challenges. And the most frequently identified challenges are listed on this slide. Toxics and chemicals of emerging concern, including PFAS, drinking water and wastewater treatment, nutrients, water and wastewater infrastructure, and then advanced monitoring and sensors, non-point source challenges, and remediation for soil and groundwater were sort of all that in that last category. We use this information from the ARIS survey and from other interactions with states, meetings and such, which I'm going to discuss later, to inform the development of ORD's strategic research action plans, STRAPs, for the period 2019 to 2022. The STRAPs outline ORD's long-term research and shorter-term technical support efforts. And I'm just going to point out that ARIS is working on planning their 2020 survey, which we hope will come out later this summer. And for more information on the ARIS survey, there's a link there. Erin, could you advance the slide, please? I've lost the arrow, so I need you to advance the slide.
I just advanced it.
I'm still seeing the old slide. Are you on slide 9?
Sorry, I think I lost connection, so I'm opening a new window.
Okay. If one of the other presenters, thank you. Okay, slide 9. So back to the strategic research action plans. For this last iteration of the STRAPs, we worked with ECOS and ASTHO to identify some state members to participate on teams along with EPA program and regional office partners to help refine the planned research and identify specific science products geared towards state science priorities. So we had about 17 state members from 14 states, both from environmental and health agencies, to participate on about a third of our research area coordination teams. And we're planning to continue that engagement with these state participants as we move to the implementation of some of this research. These are the 6 research programs in ORD, and underneath them are some of the key areas that are focus of the documents of the STRAPs. And the ones in green are the ones that closely align with those ARIS survey priorities from 2018. It's a breadth of research from water to healthy communities and land, waste, contaminated sites issues, human and environmental risk assessment, our chemicals program, looking at solutions and delivery of information on chemicals to our partners, our air and energy program, including our work with sensors and next generation methods, and then finally our Homeland Security Research program and a lot of work that they do related to environmental cleanup and preparedness and response issues. Those straps are now final and they are available, and there is a link on the site to those straps. So in addition to the insight that we gained from the ERA surveys, ORD, along with the EPA regions, regularly meets with state environmental and health agencies at our ORD laboratories across the country and also at state labs. This is really great. It's an opportunity to hear firsthand from the states about their environmental challenges and needs, and for us to share information on EPA research and available resources for the states. And over the last couple of years, we have started also hosting, in addition to hosting the states at EPA labs, we have been visiting state labs. And we have done 4 of these to date in North Carolina, Massachusetts, Washington State, and most recently Arkansas, for more in-depth technical discussions between state and EPA scientists. So next, we're going to talk a little bit about how we share EPA science and resources with the state. We have this monthly EPA Tools and Resources webinar series, which you all are on, and it's really a means for us to share EPA research and available resources. We've also, over the last few months, especially while everyone has been teleworking, been trying to offer more in-depth educational and training webinars on some of our science-based tools. We have a number of presentations on all different media posted on our research website. There's also recordings, and so I just want to draw this to your attention, and we hope that you can refer your colleagues to these webinars if they have missed them, and our webpage is linked at the bottom. We've also put together a series of, we call them stories, EPA Research State Support Stories, stories about how EPA research and technical assistance have supported states over the years. And it's our hope that if a state has a similar environmental challenge, that these stories can help them find out about EPA resources that are available to assist them. And these stories cover a variety of environmental issues in different media. They're listed there: water, PFAS, nutrients, air, etc. There is a link to the State Support Stories document, and we also have a YouTube video with some of the states talking about how EPA research has worked with them on issues like PFAS and HABs. A new resource, we have taken our State Stories document and created an interactive story map. And this is what the story map looks like. It's on the EPA research page. And across the top are tabs with the environmental issues. So if you click on the water tab, you can see how ORD has provided states support on water-related issues. And then when you click on an individual story image there, you can read the full story. And the full story pops up, and it looks like this. And so this is an example of EPA research working with states on our to beta test our cyanobacterial mobile app, and a number of states were involved in that. And we kind of lay this out in a similar format, and we have quotes in here from either state or local or other officials that talk about, from their perspective, how this work has been helpful and a positive impact for their program. And then finally, we have our EPA Research website available, and it covers different topics. And we also have an EPA Science Inventory, both linked here. The Science Inventory provides a searchable catalog of all of EPA's published research. So next, going to transition to some of the collaborative projects that we've been doing with our state environmental health experts. We have a memorandum of agreement with ECOS and ASTHO. Really, the goal is to work together to advance our shared mission of protecting the public's health from environmental threats and advancing health and environmental equity for all citizens. Some of our example projects we're going to talk about today, both the recent update to the Wildfire Smoke Guide, as well as some of our state case studies and risk communication resources related to PFAS and HABs. So with that, I'm going to turn it over to Abe to talk about the Wildfire Guide.
Great, thanks, Lisa. Good afternoon, everyone. My name again is Abe Kulungara, and I'm with ASTHO. On the previous slide, Lisa brought up the ASTHO EPA MOA, and it'd be remiss of me if I didn't mention that, and recognize the roles that Lisa, Andrea Barbary at EPA, Alex Dunn, who was formerly with ECOS and now with EPA, and Bob Vanderslice, they all played important roles in making the MOA a reality. So I want to thank them for that. So getting to the slide you see here is on the Wildfire Smoke Guide. As Lisa indicated, this is one of the projects that ASTHO and ECOS provided feedback on. ASTHO collected feedback from the state environmental health directors, a peer group within ASTHO, and prior to this guide being published and revised, it was our understanding that older documents did not address all the public health concerns. The questions that this guide addressed were correctly identified from a public health official standpoint, and it's a useful resource. And although ASTHO provided feedback for the guide, I'd like to acknowledge the subject matter experts, the different state and tribal partners, associations, and EPA involved in this project, and also the lead author, Susan Stone, and some of the other chapter authors involved in the revisions. So with that, I'll move on to the next slide, which talks about the 2019 version of the guide. The 2019 version, in our opinion, did an excellent job of conveying complicated public health strategies using simple language. New information around preparedness, ash cleanup, and exposure reduction strategies were added. For example, around strategies to reduce exposure to wildfires. It's not enough to say, keep your windows and doors closed during smoke events. Residents can always suffer from heat stress if they don't have air conditioning. So this guide definitely explains how people can keep themselves safe from smoke while being mindful of other issues that may come up, such as ozone generators. Also, the specific recommendations regarding air filters allows the public to look at effective products, and also for public health officials to create safer air shelters. So the authors definitely did add information that would overcome obstacles, and that was very helpful. This slide focuses on some of the standalone fact sheets. Risk communication is what ASTHO and ECOS members sometimes struggle with. What guidance are you going to send the public? You have to be ready. You have to respond. Health and environmental agency staff know that there's no need to send the whole packet of information out there. So conveying messages in one page that gets to prevention planning and also the information that one needs to respond is important. So with these fact sheets, public health officials get something that's simpler, that's detailed, and the standalone fact sheets support one another, And not everyone needs a fact sheet on an air purifier, or they may not have children or pets. So each fact sheet addresses a topic that may be of interest to some, but not all. And the fact sheets, again, are great and serve that purpose and are tailored individually to different topics. So the final slide I'm going to talk about before I hand it over to Sarah Grace from ECOS is on how states have used the guide. In October 2016, wildfires burned thousands of acres in the southeast. Lightning and human activity may have caused some of the fires, but many of you know Western North Carolina was hit hard, and poor air quality was an issue in cities like Asheville. North Carolina Department of Public Health used the guide to protect communities across the states, and a lot of the guiding principles in the guide are also reflected in guidance documents released by North Carolina's Occupational and Environmental EPA program. So a good example of how the guide was used in North Carolina. With respect to California, 2017 was the most destructive wildfire season on record in California at that time. It also included the 2017 Northern California wildfires, and it's infamous, was also known as the Wine Country fires. The fires caused damages of in excess of $18 billion. We at ASTHO had the former health commissioner, Dr. Karen Smith, write a blog on this topic. Dr. Smith highlighted lessons learned that would be helpful for other states. She touched upon a lot of the same principles highlighted in the guide around public advisories, preparedness, and building stronger partnerships. Again, the guide was adapted by California to develop infographics and also considerations for California's public health officials. So with that, the main takeaway I'd like to leave you all with is that thanks to the authors and the partners involved in revising the guide, public health officials have taken full advantage of the guide and in some cases have adapted it to their needs. So it's been definitely a helpful guide, and it's been updated at relevant points, and so this is something that we feel that our members are going to use for years to come. So that ends my topic on the Wildfire Smoke Guide, and I'd like to turn it over to Sarah Grace to talk about some of our other collaborative projects. Let me see if I can
Great. Thank you so much, Abe, and thank you, Lisa, for inviting us to talk today. As Abe mentioned, ECOS and ASTHO have done a lot of work in the past few years on risk communication efforts. This is because, as most states oversee their various water systems or implement various regulations related to different contaminants or environmental issues, it's become a bigger focus and an increased need for states to kind of take this on. And the big question is, how do we communicate risks, especially of some popular contaminants like PFAS and HABs. So I'm going to talk about one project we started a couple of years ago, kind of the original case studies, and then Nick will share some of the updated PFAS resources as kind of a build on to that original effort. So this project that ECOS and ASTHO conducted was to create case studies on state-level risk communication of PFAS and HABs. Both of these are priority contaminants that many stakeholders, especially states, have struggled to communicate the risks of. Although EPA has a drinking water health advisory of 70 parts per trillion for PFOA and PFAS, and draft recreational and swimming guideline values for cyanotoxins, there's still some confusion over how states implement their own regulations and communicate those regulations to the public. So to kind of help streamline some of the communications and help the public understand risks, we embarked on this effort to put together some case studies of these common contaminants. So we really wanted to frame the risk in a unified manner and help states overcome these communication challenges. So together, ECOS and ASTHO interviewed 13 geographically and programmatically diverse states on their risk communication strategies of PFAS and HABs. So we talked to both the health and environmental agencies. We conducted interviews with them on everything from kind of how they disseminate resources and what the content of those are to gaps and challenges they face. And then ECOS developed 7 case study fact sheets and ASTHO developed 6, and we held webinars on each of the contaminants. So here on this slide, you'll just see a couple of the different case studies we produced, all of which are available on the ARIS, which is, as Dave mentioned earlier, our research arm of ECOS, and the ASTHO website. So for PFAS, we looked at Michigan, New Hampshire, Pennsylvania, Colorado, Minnesota, and New York. And for HABs, we talked to Missouri, North Carolina, Ohio, Utah, Indiana, Oregon, and Vermont. So try to get some, like I said, programmatic and geographic diversity within those case studies. So for just a couple examples of some of our findings, here we have our first example on PFAS risk communication from the Michigan case study. So when we interviewed Michigan and we were talking to the staff that were working on this, they noted the importance of weekly communications, including town meetings with open and honest dialogue about what they know, what they don't know, and really being very open with the public. They also noted the importance of local officials who tend to be more trusted than some of the higher up state and federal planners, and really focusing on the meeting planning with the stakeholders and public websites for more information. They did note that a few of the challenges they saw in terms of communicating risks about PFAS to the public were relying on social media as a credible source, using the word safe because we don't really know what level is safe for PFAS, and then overall education of the public, which doesn't usually, the public doesn't tend to know the difference between acute and chronic exposure or how PFAS differs from cancer or from the effects of cancer and other things. We also took a look at HABs in Utah, and a lot of the same themes applied here. In addition to the information on communications, we discussed how state and environmental and health agencies disseminate those communications. And Utah was interesting because they really emphasized how they coordinated among the other agencies within the state. So not just the environmental and health, but also everything from kind of the agricultural sector and others to put together different advisories, put together press releases up on their websites, really focusing on guidance and how that may differ from the impact of the water body that the contamination is occurring in or the advisory that's warranted. So in terms of some of the gaps and challenges, they noted similar themes of education, multi-agency involvement, but really also the importance of establishing agency roles prior to contamination, as it's harder to coordinate after an event has already begun. They also talked about the importance of data collection and encouraging media to use language and clarity to avoid both public confusion and concern about HABs communication. So now I'm going to pass it over to Nick, who's going to talk about kind of the updated work on PFAS that we did.
Thanks so much, Sarah Grace. Hi, good afternoon, everyone. My name is Nick Porter from ASTHO's Environmental Health Team. So just have a few slides here to wrap up some of the association projects. And I'll start here by talking about some of the common risk communication themes that we found across our PFAS and HABs state case studies. I think Sarah Grace already kind of touched on many of these. We found that each state had very similar things to say about some of the themes that they were seeing, some of the gaps, some of the challenges. So the first one being that state health and environmental officials need clear, regular, honest language that builds a level of trust between state officials and affected communities. I think that we saw in most of our case studies, whenever they were, the states were, putting out any risk communication resources or information, they utilized press releases, geared towards the media, held community meetings in the affected communities, held multiple press conferences, daily or weekly updates to really kind of help build that level of trust with the public and affected communities. Also we found that's important is, public education is needed regarding some of the hodgepodge of quantitative values that are found that are meant to convey acceptable levels of exposure. So I think, for example, groundwater guidance values, state-specific MCLs, lifetime health advisory values, all of these terms, can mean different things and can be confusing for the public, especially with regard to exactly the type of information that they're trying to give or to convey regarding exposures. I think that, some states found that communicating one-on-one with residents in their states really helped clarify some of these questions around exposures and really helped with that public education piece. Another thing that we found was kind of the need to make sure that your information and guidance and resources that are put out for the public are at an appropriate level for folks to read and understand. Some states mentioned using an 8th grade reading level or a 6th grade reading level to make sure that this information is clear, especially for those that may not have a background in environmental protection or environmental health. We also found that multi-agency coordination is important. obviously federal agencies collaborating with state-level agencies is important. EPA, CDC, ATSDR, the Agency for Toxic Substances and Disease Registry, they all kind of collaborate with state health and environmental agencies on different environmental health concerns and, issues around PFAS and harmful algal blooms are no different here. Also, we found, especially with ASTHO's side of things, in many cases, the states that we talk to, and these are the health agencies within the states, they collaborated with their environmental agency counterparts within the states. So that kind of intrastate agency coordination is important and really helpful, as well as state to state. And then finally, we found that being consistent and comprehensive when communicating with the public is important. It's important to come out with a unified message across state agencies, and some of the things that can help with that are continually engaging with the public, making sure to keep them updated. Some of these community meetings and one-on-one meetings can certainly help with that. And we also heard that from multiple states that it's again important to be consistent and comprehensive because with the rise of social media and the spread of misinformation, sometimes misinformation can spread very quickly, and it's important to kind of make sure to clarify and get the correct best available information out there. And so following the project with the speaking with the states and creating the case studies, the next step was to create a risk communications hub around PFAS and contaminants of emerging concern. So using some of the lessons that we learned from the state case studies, both ASTHO and ECOS worked together with EPA ORD to develop a set of helpful tools, materials, and strategies for PFAS risk communication. So these hubs include guidance materials for risk communication, including toolkits, fact sheets, templates, etc., as well as a collection of state and federal resources. We include state case studies and different hodgepodge of state and federal PFAS websites, as well as, importantly, resources in other languages. And, again, this communications hub is geared towards PFAS, but can also be used to inform efforts on other chemicals of emerging concern. And you'll see the links to both of those websites on this slide. And with that, I will turn it back over to Lisa. Thank you so much.
Thank you. So to wrap this up, I also wanted to call out some other resources that we have related to PFAS for the state and others. We have information on the status of EPA's research and development on PFAS. We have a web page on that. It's fairly recent. We will post information about PFAS research and expected timelines for completion on this page, including methods and other tools. We have also a EPA PFAS data and tools web page, and this includes links to science-based tools and data and other information related to PFAS through EPA's website. And then the ITRC PFAS team has developed a technical and regulatory guidance document, as well as a series of fact sheets and some training videos that provide excellent information on PFAS for the states and others. And the links to those resources are provided. In summary, these partnerships between EPA, ORD, and the states, particularly through our work with ECOS and ASTHO, are very, very important to us, and we're committed to continue to work together with these groups towards a healthier environment. Probably today more than ever, our choices and decisions are impacted by facts and concerns and surrounding public health. And together, we can carry out our responsibilities in a more effective manner with greater understanding and connection to our peers in environmental health through the state. And we will continue to work together with state environmental health leaders on some joint efforts that can benefit the public. And my last slide is just a preview of a new project that we're going to be working on together under our Memorandum of Agreement with ECOS and ASTHO related to wastewater issues and COVID-19. Early evidence suggests that SARS-CoV-2, the strain of the coronavirus that causes COVID-19, RNA levels in wastewater may be a leading indicator of rising community infections. And so we're going to work together to pull together information into a high-level briefing paper on this issue, wastewater surveillance to detect community spread of COVID-19. Pulling together the information on what we know, what we don't know. There's a lot of ongoing work by a lot of different people in this area. So we plan to outline some of the methodology that is being used to track medical and social interventions, also information about sample collection and best practices. Look at areas of potential use in the U.S., including trends in occurrence, assessment of community infection, and risk communication and messaging for the public. And we'll also be looking to at any planned pilot projects that involve EPA in the states, as well as identifying research gaps. So my last slide is actually the contact information for all the presenters today. Please feel free to reach out to any of us if you have additional questions. And all the resources that we've talked about today, you can find more information about through our new EPA Research to Support States website. So I want to thank Abe and Nick and Sarah Grace for presenting with me today.